In this lecture of PHA 421, we will talk about sampling strategies in research and mechanism of data collection. So over here we have the map for the things we will discuss today. We will talk about sampling. We will also address sample size consideration. And then we will move to talk about data collection tools. So the first thing we're going to talk about is sampling, and under sampling we're going to address two things: terms, definitions, or glossary, and then we're going to also talk about the types of sampling. Starting with the first item, which is terms. Population. Basically, a population is all the elements that meet a certain set of criteria determined by the researchers. Basically, researchers usually, when they set up to do any research study, they decide who is the target population using a set of inclusion-exclusion criteria. So maybe they're going to exclude those that had complications, those that had other types of diseases, etc. And therefore, those that meet the inclusion-exclusion criteria, uh, their entirety become the population. According on the definition of population, therefore, a population could be a very large number or a very small number. So if the numbers of people infected with a certain virus is the population, then the number maybe at the beginning is a small number, and therefore the population could be a small number population. Um, we also talked about maybe previously the difference between the target population and the attainable population. So the target population is the population that researchers are interested in studying, whereas the attainable population, this is the population that you can have access to. And we give the example, for example, if my population is teenagers in Lebanon, the attainable population might be teenagers enrolled in schools. Those are the ones I can get to. The more the attainable population is covering the target population, the better. It would be problematic when the attainable population becomes just a very small subsection or very specialized subsection of the general population. So we have examples for population. So all registered pharmacists in Lebanon could be the population. Um, so if you're thinking about it, you can say all pharmacists, all Lebanese pharmacists is my target population, and my attainable population in all registered pharmacists in Lebanon, and hoping that almost 94 or 95 or 96 or 97% of pharmacists are registered. You may have a few percentage that are not registered. Maybe they're no longer practicing, or maybe they stopped practicing to study, or maybe they traveled and they're coming back. Something. So, but here the example is that the target population and the attainable population are very similar. Or at least let me rephrase that. The attainable population is a very big part of the target population. Another example, for example, you can talk about diabetic cases being your target population. Women in general could be your target population. So the first quiz was what was the population under study in the British doctor studies? The British doctor study here, a study that looked at British doctors, and they mailed them questionnaires and they did a follow-up over time, basically looking at smoking and looking at heart outcome. And I think this study was maybe in the 60s. So here the population, you may say the population are British doctors, not the. Or you can say that maybe the target population are men, and the attainable or reachable populations and the doctors. In that specific example, if you think that your population are men and the attainable are physicians or doctors, here your attainable population is not a good representative of the target population, because as you may already know, doctors have specific characteristics that are not applicable to all men. Highly educated, maybe they have a better access to health, and other things. In another example is what is the population and the Women Health Initiative? Come in, the Women Health Initiative, this is the clinical trial that randomized women, postmenopausal women, I should say, into receiving either hormone replacement therapy in two forms, or receiving placebo, or receiving nothing with a diet change. And they looked at bone fracture and heart outcomes and breast cancer and things like that. And I think that study maybe was in the 80s, 90s, actually. So the obviously the target population here, postmenopausal women. All right, so let's continue. So we're done with population. Sample is your subcategory, sub-entity that you're taking out of the population to run your study. So watch out carefully when you're talking about a study. The people that participated in your study, your volunteers, those are your sample, they're not your population. And there's a lot of effort put into how to take the sample, how to select these people so that you get a good representative sample. Um, كمان as a reminder, بما أنه you're working with the sample, please remember that everything you're going to observe in the sample is going to be an estimate of what is happening in the population. So whether you're looking at uh, clinical trial looking at reducing the risk of hip fracture, for example, among elderly, the rate of hip fracture that you're going to observe in your study, this is an estimate of what will happen in real life if people were treated. And keeping that in mind is going to help you understand why we test hypotheses, why we get p-value, why we do confidence intervals, because we're working with samples, we're not working with populations. The example that I usually use, and it's not totally related to health, but it kind of help is whenever you have an election. Before the elections, there will be a lot of polls, a lot of opinion poll asking people if they're going to vote yes or no and who are they going to vote for. So the results you get from the polls, these are results derived from the samples, and these are estimates. They're supposed to predict what's going to happen on election day, but we will not know exactly what's going to happen till election day. So the results you get from the polls, whether it's CNN, wala Gallup, wala Fox News, wala what have you, these are going to be estimate of what is going to happen on election day. And hopefully election day is your population being observed, which it doesn't happen a lot. And therefore, these estimates are expected not to be exactly like the real values in the population, and to evaluate how good they are. That's why we do the testing hypothesis, the p-value, and the confidence interval. So that's just a quick overview of things that might help you later on understand the testing hypothesis. Continuing with the definition, strata, that's the plural of stratum. This is when your population is already put into layers that is defined by certain characteristics of the population. So, مثلا, the doctors could be stratified according to their specialties. So, cardiologist, pulmonologist, etc., surgeon, etc. These are characteristics of the surgeons, and you can put or that population comes into these layers. University students come in according to their majors. Come in characteristics of university students is what are they studying, and therefore the stratification of university students is by their major. You also have an example here of population cancer patients. Um, I mean, it could be like the grade of cancer, grade 1, grade 2, grade 3A, grade 3B, and then grade 4. Come in, it has to do with the characteristics of that population. There is one more definition that I don't have here, but you also need to think about is clusters. Clusters resembles a lot of stratification, but this time it's not a layer based on a certain characteristics, rather it's based on clusterification of your population. So your population aggregates a group of people that may have nothing in common. Okay, but they are aggregated in this way. The easiest way to think about cluster could be geographical residency. So people, when they live in geographical clusters. In schools, students cluster in classrooms. Patient buying a certain medication, they cluster by which pharmacy they go to. Okay, so that's cluster. Okay, so going back to our map, we finished the glossary. Now we're going to talk about the types of samples. And specifically, there are two major types of samples, the random and the non-random. Another term that I use, or you may see people using, who is probabilistic sample and non-probabilistic sample. And basically, this is just whether or not the selection procedure is based on a random process or not. The best way to know if your sample is random or not, ask yourself this question. Does everybody stand a chance of being selected? If the answer is yes, theoretically speaking, then it's a random. If the answer is no, if a group of people that do not stand a chance of being selected, then your sample is non-random, yani non-probabilistic. Under the random, we're going to talk about three types: the simple random sample, the stratified random sample, and the cluster random sample. First one on the list is simple random sample. This is basically when you have the list of everybody in your population, or what we call a sampling frame. Okay, and out of that sampling frame, you draw a random sample using computer algorithm or any type of random fashion procedure. So the key here is that you need to have a sampling frame. A sampling frame, you can get it, for example, if you want to study LAU students. If LAU students is your population, then you can get a list of every LAU student by going to the registrar. That is feasible. If you want to study pharmacists in Lebanon, and remember the attainable population is registered, then everybody is listed at the OPL, and you can get that list. That would be your sampling frame. Similarly, مثلا, let doctors, you can get it from their order of physicians. Every time you have a list of everybody, then you can consider that to be your sampling frame. مثلا cancer patients in Lebanon and a registry, and in that registry everybody is listed, and therefore that could be your sampling frame. You take that sampling frame and you take a random sample from it, then this is a simple random sample to be contrasted with a stratified random sample. So the stratified random sample uses the fact that your population has a built-in strata in the layers, and what you do is you take your samples from every layer separately. So a very simple example would be the example of LEU. Students are stratified according to the school, and you take your sample from every school. This way you make sure that every school is represented. Is you disregard the school and you just take a random sample, there is always a chance that a small school, let's say مثلا nursing or pharmacy or medicine, for example, they might not end up being represented in the sample, or they might be represented only by one or two, which is not enough. Stratified random sample um, uh, makes sure that you're going to take a simple random sample from every strata. Let me see if I can help explain that a bit more. So if you think about LAU student being your population, so if this is LAU students, كل population, and we want to take a sample. However, نعرف نحن إنه عندنا schools inside, so that could be مثلا the school of pharmacy, this could be the school of nursing, that one could be the school of medicine مثلا. Okay, arts and sciences is much larger, هيك مثلا, and engineering is also a large. I hope I'm not missing anybody. And architecture مثلا, business بعد في يمكن, and here's business right there. Okay, maybe I didn't draw it proportionate to the real size, but the point is, if you do a simple random sample those will not be in order, and everybody will be shuffled together, and you take a sample regardless of where they're coming, and therefore your sample might miss masalan the nursing. However, a randomized simple random sample, you're going to take from every one of them a sample. Okay, so as if this is a population, and you're taking a simple random sample from pharmacy, simple random sample from nursing, etc., and then every piece will be put together to create your final sample. Hey, you make sure that your sample is representative of the entire population. Now, there are two approaches for this. The most widely used one is knowing that Masalan art and sciences represents 30% of the population. Therefore, the sample that you're going to take from art and sciences should be 30% of your sample. If business is 20% of LAU students, then the sample taking from business is also supposed to be 20% from the entire population. I mean, 20% of the sample. Okay, Heiki, you end up with a sample that has the same distribution with regard to the stratum than the general population. This technique is called proportionate to size. Your sample is going to be proportionate to the size of the stratum in the population. That is the most widely used technique. Another technique is a non-proportional to size, and I'm not going to go into that. All right, so let's continue. A third type is the cluster sample. So I told you that sometimes your population clusters, and what you do is to be able to take your sample, and it's hard to break that cluster. So you end up doing taking a sample from the cluster. So your unit of sampling is no longer individuals, but rather it's the unit of clusters. So maybe you want to take a sample, مثلا, from from people in Lebanon. نعرف إنه people cluster inside households cluster inside neighborhood cluster inside villages cluster inside um, قضاء cluster inside محافظة, and the five محافظة create Lebanon. هلا, what I'm describing now is called the multi-level cluster sampling. Okay, because you're taking a level over a level. However, if you're set up and your sample is pure cluster, then you can go ahead and pick one cluster or two cluster or three clusters at random. Think about classes, مثلا. I want to take a sample of students cluster within a class, and therefore I pick a class at random, and then once I pick that class at random, I will take everybody inside that cluster. So the unit of sampling becomes your cluster. This is, as I said, typically happens when there is a clustering in geographical area, but it doesn't have to be geographical area. It could be anything. And the example I usually give is the study that people like you may want to do the study in Lebanon, and you think about Lebanon. Lebanon is made of five governorates. So you say, okay, and depending upon how big your sample is. So عندنا five محافظات governorate. So out of the five governorate, you may pick one at random. So this is your first cluster. Inside that محافظة, you have قضاء. Okay, and so you may pick one at random. Inside that محافظة, you may have villages. Okay, and you pick a village at random, and inside the village you may have هلا هون at this level you may consider your village to be your cluster and take everybody مثلا, or inside the village you have neighborhood, and then you take a neighborhood at random and you may measure this entire neighborhood. Okay, هلا, knowing that sometimes what also is done is you may decide to take every محافظة and repeat that process inside every muhafaza. And inside every muhafaza, you decide that one qada is not enough. You want to take two qada, and from every qada, you want to take two villages, and then from every village, take an entire area. That would do as well. But the point is that this is called clustering sample. Um, that was widely used لما كانت اليونيسف تعمل study to measure what's the prevalence of vaccination in Lebanon. They are for the children vaccination in Lebanon. They used to do this type of sampling. So that covers the three major well-known random sampling technique: the simple random, the stratified sample, and the cluster sampling technique. Let's move into the non-random. The non-random, there are two major ones: in convenient quota. So convenient basically is when you take a conveniently available sample. So مثلا in TV anchors, when they go down to the street and they talk to people to ask their opinion about a certain political issue, that is a convenient sample. That is in no way a random sample. The problem with convenient sample is that it can be prone to bias, and it can be considered the weakest form of sampling. However, I have to point out to an important issue here is that sometimes convenient sample is used in RCTs. So think about what happens in RCT. So in RCT, I may have mentioned this before, they need individuals that have the disease. So a pharmaceutical company needs the people that have the disease to be treated or placebo to see what's going to happen. So the point is, where do they get them? Typically, the gatekeeper that are going to get from this entire population of people with the disease, the gatekeeper are going to be physicians. So whole they go to this physician, for example, these are going to this physician, and these are going. So by going to physician and asking physician to recruit patients, and in the recruiting process, they have to ask them they want to participate or not. So there is some sort of volunteering process happening here. This is considered a convenient sample because you're not picking at random. You're picking through the physician. The physicians are recruiting, so you're going to end up with really um, a convenient sample. However, that is not a bad thing by itself because remember, there's the inclusion criteria and exclusion criteria that assures that the people that going to end up being part of the study meet a certain standard. هاي واحد. Second, the study doesn't end here when you're doing an RCT. So after all the physicians, have grouped the sample, remember the study doesn't end here. What happens after that, when we talked about this extensively, is the randomization. So you're going to split your sample into two groups: the group that is going to be treated and the group that is going to receive the placebo. And these two are equivalent, and therefore any effect you're going to observe is going to be attributed to the disease and nothing else. So that design right here makes that the study has good internal validity. All right, internal validity. The problem is how good of a sample you got right here, and how much this over here, the sample, is representative of what is happening in the population, and that's, we talked about it, is your external validity. Okay, so just because you're taking a convenient sample, it doesn't mean automatically that you have a problem with your internal validity. However, you may have a problem with your external validity depending upon how you do it. And that takes us to the next point to be discussed, and this is the Quota sample. So Quota sample is a convenient sample. However, you put some restrictions, or what we call quota, to make your convenient sample resembles your population. يعني احنا بنعرف the population is 50 men, 50 women. You say, okay, in your convenient sample, get me 50 men, 50 women. And you know that 20% of men are married, and 20% single, and 10% divorced. So you say, okay, in the men, get them to me this way. And same thing for women. And also you may add another quota regarding to age. So what you're doing is you're forcing your convenient sample to look like um, the population. So while you're sampling, you end up with quotas that you need to fill. يعني مثلا at the end of the day, I want 200 men divorced, age above 50. Okay, and you need to fill that quota. And by the time this quota is filled, you do not take any longer men above 50 divorced because that quota is filled. Okay, and that is the example that resemble exactly what I talked about. Okay, so how do we define the quota? We define the quota based on what we know about the population. Now, our knowledge of the population will allow us to build the quotas. Where do you get information about the population? From um, surveys that were done on the population أو census or مثلا عندنا بلبنان في the CAS Center for the Administration of Statistics. They have a lot of statistics on the Lebanese population in terms of age, with gender, with distribution, and in what area they're present, etc. So you can use that. Okay. So هيك بنكون خلصنا sampling. We talked about the definitions, we talked about the types, random, non-random, and we talked about all the different types of samples. Quiz. For each of the following example, please specify the type of sample used. To study pain pediatric cancer population, the researchers interviewed all new pediatric patients coming to a major referral center. If you want, pause the video, find the answer on your own, and then come back to the answer. The answer is that this is most likely to be a convenient sample. However, there is a rationale behind it. That rationale is that because it's a referral center, pediatric center, and because we think that the patients in that center are representative of the population, therefore we think that it's a good sampling, even though it's a convenient sample. Question number 2. To study survival among open heart surgery patients, a list of all patients is obtained from the Ministry of Health, and a sample was taken using a computer algorithm. Again, if you want, pause the video, find the answer on your own, and come back. The answer, this is a simple random sample. Simple because we didn't talk about any type of stratification. Had we said that the list was first stratified by gender, يعني men alone, women alone, حتى لو ما قلنا the term stratified. If we just said that the list of all patients was obtained, it was divided men and women, and then a random sample was obtained from men and a random sample was obtained for women, that still is a stratified random sample. Okay, one more quiz for the following research question. Identify 3 different sampling techniques. So think about a medical center that is interested in studying its customer satisfaction. Can you find 3 ways of sampling their customers to ask them about their satisfaction? Come in, you may want to pause, come back for the answer. So I'm going to suggest the 3 ways. You may have come up with different than the ones I'm going to suggest. From the from the admission office, you can get the list of everybody admitted to the hospital, and you can take a simple random sample from that and go talk to these patients. Or you may decide come in from the admission office to stratify the patient according to the department they're admitted to, and then that will become a stratified random sample. Or you may just want to go up the floors and find somebody and talk to that person and ask them. That would be a convenient sample. In that convenient sample, you may build into a quota by saying, oh, no, I know that 15% of my customers are actually from the internal medicine department, and therefore go to the internal medicine department and get me 15% of the sample. Okay. All right, so we finished sampling. Let's talk about sample size. And to talk about sample size, you need to understand the type 1 error, power, and effect size. لأنه these 3 things impact your sample size. So typically what happens, if you want to run a study, you want to make sure that not only you have a good sample, that the procedures that you're using to get your sample are good and procedures that are going to yield a sample that is representative. But also a big question is how big my sample needs to be for me to do the study. And that answer usually is answered by a statistician, is answered by providing these 3 points or these 3 informations to the statistician so that the statistician can calculate the sample size needed. So the type 1 error, the power, and the effect size. All right, so let's talk about each one separately. Type 1 error is, as you may remember from the testing hypothesis, when you're testing a hypothesis to be able to declare that your results are statistically significant, you need to calculate a p-value. P-value عادة you get it from running a test. So you may run a t-test, a z-test, a chi-square, and or any kind of these tests. And that test is going to give you the p-value. Now that p-value, to be able to say that the results are statistically significant or not, that p-value has to be compared to alpha, يلي هو conventionally is 5%. So if your p-value is less than 5%, you declare your results to be statistically significant, and therefore you declare that whatever results you observed in your study, they also are existent in the population. Okay, so maybe you're observing that the treatment arm has an improved heart stroke volume compared to the placebo arm, and you run your statistical analysis, you get a p-value that is small, you declare it to be statistically significant. That means that this improvement that you observed in the stroke volume of the heart is actually a real finding that is in the population. Okay, so Haided type 1 error is also called as alpha, is equal to 5% conventionally, and rarely will we change it. So answering the first question, what is type 1 error? 5%, that's easy. We're not going to change that. That is going to remain the same. The second one is power. So what is the power of a study? Power of the study is the capacity, the ability of the study to detect a difference, a change, an impact, if it really exists. And to try and make it easier for you to remember what power is, I use the example of, think about people that testing for a certain disease. So في عنا people coming to be tested. Okay, so nowadays we're talking about COVID-19. I hope in the future that will not be an issue. But let's say that some people are actually have the COVID-19 and some people do not have the COVID-19. We test them using the PCR, and the PCR either comes to be negative or comes out to be positive. Okay, now if a certain person has the disease, so a person has the outcome, and the test comes positive, okay, so the test is able to capture the disease and label it as positive, then this is a true positive. This is what is power in research. So in research, if there is a finding, if an effect really exists in real life, and your statistical analysis were able to detect that effect, then this is power. Okay, so power is a probability of correctly concluding that an intervention is effective. Maybe I should say efficacious, it doesn't matter. So it's the probability of being able to detect an effect, an impact that really exists. Okay, now a minimum power is 80%. Some researchers مثلا بالRCT they want a 90% power, a 95% power, but the minimum is 80%. If you go below 80%, that would be problematic. So that's number two, power. And number three is effect size. What is effect size? Effect size is how much your drug, if you're analyzing, if you're testing a drug, is able to make a change. مثلا in the first example is by how much the drug will reduce blood pressure. That is your effect size. By how much smoking cessation will increases the risk of CVD. That is effect size. Okay, and how much an effect, how much of an impact is there. You're maybe treating people that have osteoporosis, and your outcome is reducing hip fracture. So by how much you expect the rate of bone fracture will drop. So maybe before treatment you knew that 12% will have a hip fracture within 5 years, and by treating it got down from 12% to مثلا 8%. That difference from 12% to 8%, this is your effect size. Okay? Now, how are these things related to sample size? If I want to study drug A, okay, so drug A has a certain effect size, a well-established effect size, okay? However, the first researchers do 80% power, while the second researcher do 90% power. So what is different in this example is power, okay? All right, so 80% power versus 90% power. How is that going to impact sample size? Well, if that over here, if this person requiring 80% power, by calculation end up needing, let's say, 1400 participants, then here you're going to require a larger sample size. So may you require, مثلا, 2100. Okay? So كل ما الpower increases, كل ما sample size required increases. Okay, you need more power, you need a larger sample size for a given effect size. Effect size is the same, it's not changing. So that's the first impact, power on sample size. The next one, this time, لا, we're going to compare two medications. So عندي drug A, and let's say drug A reduces the risk of hip fracture by 8%, whereas drug B reduces the risk of hip fracture by 5%. Okay? And both studies بدهم power of 80%. So both of them, هيدا بده 80% power, and this one wants 80% power. So the power is not an issue here. Power is constant. Okay? However, this drug is stronger. It has a larger effect size. The impact of this drug is bigger. And therefore, to reach 80% power with this effect size, your sample size needed, let's say, is 1800. Then here, because it's a smaller effect, it's a weaker effect, to be able to reach the same power as here, you would need a larger sample size. Okay, maybe 2400. Okay, so here كل ما effect size is smaller, كل ما sample size needed is bigger to reach a certain power. And I can say it the other way around as well. I can say كل ما effect size is bigger, كل ما sample size needed is smaller to reach a certain power. Okay, so let's try and recap. When you're doing a study, Ilna, your sampling technique is important, but also your sample size. What are the three things that impact your sample size? On one hand, you have power. Okay, كل ما الباور بيعلى كل ما الsample size بيعلى. On the other hand, you have effect size, which is how strong is the outcome you're observing. كل ما effect size بيعلى كل ما sample size needed بيصغر. Okay, and I also told you that there is type 1 error, يعني alpha, but let's keep alpha at 5% constant, and let's not worry about it for now. All right, so here's a quiz. In this quiz, you are asked, so in the following example, identify the sample size, the effect size, the type 1 error, and the power. I'm going to read it for you, pause the video, try to find the answer on your own, and then hit play. Reductil is a drug that was originally introduced in the market as a weight control drug. Later on, case reports had suggested that the drug might be related to increased risk in major heart outcomes. To investigate the issue, a major study was carried out called the SCOUT, which collected information on 4,906 overweight subjects taking the drug and 4,898 taking a placebo. The study was able to show an increased risk of 16% in the heart outcomes. The authors concluded the study had very high power, more than 90%, due to the large sample size. So let's answer the question, what is the sample size? Sample size, you need to combine the two numbers, the 4,906 to the 4,898. That's the sample size. The effect size. Well, they tell us that the study was able to show an increase in risk of 16%. So that increase in risk, 16%, is your effect size. Type 1 error, it doesn't say anywhere in this paragraph the type 1 error. But if I were to assume, I would assume it to alpha equal 5%, but it's not mentioned. And finally, power. Well, they said to us that power was greater than 90%. Okay, last question, which is not related to here, but anyway, if you were to guess what type of design is the study, um, what would be your guess? The hint comes from this word right here, placebo. And the only time a placebo is given is when you have a clinical trial. Yani this is an experimental design. So interestingly enough, this is an experimental design in RCT that was done after the drug actually hit the market. So typically this is called a phase 4 clinical trial, part of the post-marketing research. Okay, so coming back to our map, بعد ما خلصنا sampling, we talked about the sample, so the type 1 error, the power, the effect size, and we talked about how these things actually affect the number of people you need to recruit. We still need to talk about data collection, like how do you proceed in terms of collecting information. Um, with regard to data collection, we're going to talk about two issues: the issue of the method of data collection, the tools of data collection, and the quality of the data, I mean, of the data you collected. So for methods, we're going to talk about three major types of data collection methods: the observational methods, the self-report methods, and the biophysiological method. All right, so let's start with the first one. Observational method is basically when you observe your outcome. So your outcome has to be something that is observable. So it could be a behavior, it could be a performance, it could be an activity, it could be a time, something that is observable. Non-observable, you cannot observe them, obviously, like feelings, beliefs, attitude. هيك قصص, you cannot observe them. So they're good in looking at uh, observational outcome. Um, they reduces reporter interference لأنه typically what happens is that the observer try to be, otherwise if the observer is not hidden, you're going to run into what type of bias we talked about. That we may have talked about this or not, but in case we did talk about this, try to remember it on your own. If you did not, then I'm going to mention it now and try to remember it when we're going to talk about the bias. This is the Hawthorne effect bias. If you remember the Hawthorne factory, they brought a group of researchers and they started doing things to see how that thing is going to impact the productivity of the workers. And because the workers knew they were observed, they no matter what they did, they got a better outcome. So mention هيك, a lot of times the observer is hidden. Think about the example of studying children and the behavior of children. Usually the psychologist is hidden behind a double mirror, and they're trying to look at what the children are doing. They're looking at their things that are observable. And the example I like to give is the example of Sesame Street. When Sesame Street was first introduced, they wanted to know whether the presence of these big puppets is a good element ولا لا. So they got a group of children and they put them in a room with the TV on, and وكان في toys. And Sesame Street was playing on the TV, and the observers were observing the time the children are looking at the TV versus the time children were not looking at the TV. And they noticed that every time Big Bird, this big fluffy yellow bird, is on screen, children would be much more interested in Sesame Street than when the Big Bird was not on screen. And therefore, they concluded that the presence of big Muppets might be a very interesting thing to do, and it was a game changer in terms of the TV for children in the US. Anyway, the point is, um, you can observe things like that. And what happens عادة, the observer, they have a list of مثلا things they want to observe and they tick every time that thing happens. Um, However, the problem is the ethical aspect, like are we allowed to observe? And if we're observing, shouldn't we like let them know that we're observing? And when do we let them know? After the fact or before the fact? And you need to consent, etc. um, so the last one I talked about it, the people they know that they're being observed, which means that the number one here over here, that was not about the Hawthorne effect. That was about the reporter interference. This is when Um, I should have. I'm sorry. I'm correcting this. So the reported interference. This is when the person collecting the data interfere with the data collection itself. خصوصا إذا كان مثلا physician and the person reporting their symptoms to the physician, they might hide some of this, some of that to please them, etc. So anytime the reporter is not part of the data collection and like present, uh, observational method is good. For this one, the later one, this is the Hawthorne effect. You know, being observed is is problematic. Question, and you may pause and try to answer that question and come back. Can we observe medication use? So the answer is yes. مثلا in nursing home, they observe the elderly actually putting the drug in their mouth, or you can take the bottle and count how many pills remain in the bottle. That would be like an observational technique as well for medication. Okay. The second method is self-report, and I probably need to tell you that the majority of the data we deal with comes from self-report. This is where people actually report the information you're looking for. And self-report works when you want to measure things that are unobservable, مثلا attitude, beliefs, feelings, etc. But also works when things that can be measurable. So you may ask a person, do you smoke? Yes or no? And they will report if they smoke or no. مع أنه smoking can be observed. You may ask people مثلا about their age, and they'd have to report it. I know you can go and check the records for that. You may ask people about their GPA, and they may report it to you. Again, although the record is somewhere there, but it makes things much easier for people to report the information. And for the most part, people do not lie. They tell you the correct information. There are two major arms of self-reporting, based on an interview where there is an interviewing asking the question and the person giving the answer. So this is the interview schedule, or self-administered where the person is given a questionnaire and they fill it on their own. Kill technique has its advantages and its disadvantages. Um, but in general, when you're doing a self-report, you have to do a lot of work on working, I'm sorry, like you have to do a lot of work in preparing the questions. The questions have to be worded correctly. The questions have to be, there are a few things that you need to avoid. مثلا the double-barreled question. This is coming from the double-barreled guns, and that's when you ask two questions in one. This is very bad. Like, um, uh, are you suffering from symptoms, and are you taking a certain medication, and does it cause a side effect? So when a person respond yes, are they saying yes, I'm taking the medication, well, yes, I have symptoms, وإذا قالوا no كمان. And therefore you should avoid that. You should ask every question separately, like, are you taking medication, yes or no? In case of yes, are you suffering from side effects, yes or no? In case of yes, can you tell me what these side effects are? Okay. So a lot of work is done on the format of the questionnaire, on the order of the questions. Where do we start? Where do we end? ما بدك تبلش تكون عم تحكي على socio-economic questions, jump to health question, come back to socio-economic questions. كمان it's very irritating for people if you ask a question at a certain point in time and then you come back and you ask a very similar question. It feels like you're not listening, especially for things that are uh, clear, مثلا مثل married or not, or do you have children or not. So imagine you've asked them if they have children, وقالوا لك yes, and then as you're collecting data on their health, and now you reach a point where you want to collect data on their family's health, uh, you ask them like, so do you have children? Again, أو العكس, which is worse, if they tell you I do not have children, and then you reach the level of the family health, and then you ask them, can you tell me about the health of your children? And they told you they don't have children. مشان هيك there's a lot of work on the structure of the questions. For self-administered, they have to be um, inviting, easy to read, easy to find the answer. The type of answers available, more and more is worked on providing answers that are close-ended rather than open-ended question, etc. So this is a huge field by itself, and we're just touching like a simple touch on that field. But a few words about the difference between self-administered and interview. Which one is better? طبعا self-administered questionnaire is save money, and it allows anonymity, and every time anonymity is needed in terms of for like questions that are sensitive, questions that maybe relate to a certain infectious disease, ولا مثلا things that in terms of their things that they might feel ashamed to report in front of you, حتى for like income, they might try to hide their income. In a questionnaire, people are more likely to be honest in their answers. Okay. However, interviews are still considered to be superior لأنه when there is an interviewer in front of you, there is a higher chance of people filling the answer or answering the questions. There is also a higher response rate in terms of answering all the questions. The interviewer may explain some questions that are not clearer at the طبعا with a certain training. um, you may reach a wider audience, someone who doesn't like مثلا to read long questionnaire and answer them, or maybe someone who's a bit elderly, or someone عينيته ما قدامه, etc. Okay, so you may able to reach a wider audience. In this slide over here, you have examples of different type of questions. قلت لكم في كتير شغل على the questions. في types of questions: dichotomous, multiple choice questions, cafeteria, all the way down to ranking و Likert scale, etc. حتى the scaling قلت لكم في Likert scale. Likert scale is every time you're asked to your and your answer is going from strongly to agree ولا strongly agree. I'll strongly very often to not at all. Every time if you had a ranking the disorder, then this is called the Likert scale. Another one that is very widely used is the visual analog scale, and typically you may be given مثلا a line and you're told this one is for pain. مثلا bottom is no pain at all. The top is the worst pain ever, and you're asked to specify where your pain is, and by pointing to a certain point on the line, the distance bottom to the point is considered your pain. There are other types of visual analog scales out there. بالhospitals بيستعملوا faces uh, and like others. هول كلهم they are also techniques of data collection, and there's so much to talk about data collection techniques in terms of قلت لكم you should not repeat a question when that the repeating the question might be frustrating to the person answering you. However, sometimes we do repeat a question for things that are not very obvious. That's to make sure that you're actually getting the correct answer. They're not just answering from the top of their head. And this is basically done more in questionnaires than in interviews. So I may ask you how satisfied you are with your education at LAU, and later on I'll ask you something that about satisfaction and LAU and education, but maybe with different words, just to compare your answer on the first one and the second one, and make sure that you are giving a real answer and not just picking at random. All right, the last way of collecting data هي biophysiological. This is whenever you're going to run lab tests on مثلا blood, urine, fat, or whatever. These are very good ways, and the answers you get are of a very high quality. The disadvantage is that they may be sometimes they're intrusive. They may require pricking. Also, they're expensive. And one issue that we need to make sure when you're doing a biophysiological data collection is the validating your tool. يعني your scale might be malfunctioning, and therefore you need to scale it every time. Make sure that it's working appropriately. لأنه easily you may overlook errors just because you have very much confidence in your instrument. Okay, so data collection methods, the three methods are done. We're going to now move into the quality of data. And when we're talking about quality of data, two issues come at hand: the reliability and the validity. وهون طبعا لما عم بحكي على validity, I'm not talking about the validity of the study. يعني ما عم بحكي على internal and external validity. I'm talking about the validity of the instrument, of the data collected, okay, which is quite different. So in very wide term, reliability is basically replicability of the results. Means that the instrument you're using is going to give you every time the same answer if you repeat it. The example, مثلا, scale for weight. You step on the scale up and down, up and down, up and down. Every time you get the same measurement. So مثلا every time you're getting لنقول 60, 60.5, 60.2, 60.1, 60, 60, 60.1, 60.2, you're still getting over and over the same result, and therefore the result you're getting is reliable. Okay, it can be مثلا two interviewers interviewing the same individual. They also should get you the same answers. So that's reliability. Reliability is the replicability, is stability of the instrument. The instrument gives the same measurement. However, it doesn't mean that the answer you're getting is the correct answer. مثلا نقول if somebody's weight is 60 and they step on the scale and the weight they get is 120. Okay, up and down on the scale: 120, 120.2, 120.5, 120.1, 120, 120, etc. So here the scale is reliable. However, there is a big margin of error, and therefore the scale is not valid. Okay, so if reliability is stability, validity is getting the correct answer. And therefore, if I want to measure depression among a set of patients, if all my questions are addressing anxiety or stress, حتى لو my questions or the set of questions, the questionnaire is reliable, but I'm not measuring depression, I'm measuring anxiety, then it's not valid. Okay. مثلا عم بعمل لكم امتحان for this course, and all my questions بدل ما يكونوا about research, all my questions are about the drugs utilization, pharmacology, chemistry, or even worse, they might be questions about English. Then although my exam is reliable, but it's not valid because I'm not measuring your knowledge about PHA 421. I'm measuring your knowledge about the English language. Okay? So هذا الفرق بين reliability and validity. Reliability means stability, validity means correct answer. And therefore, both of them are required in any tools, in any measurement, in any type of data that you're collecting. You want your data to have both. However, you should know that reliability can exist without the instrument being valid. However, validity cannot exist unless the tool is reliable. ما فينا نحكي validity if the tool is not reliable. Think about it. كمان the weight. If your weight is 65, تطلع على scale مرة بيعطيكم 50، مرة بيعطيكم 65، مرة بيعطيكم 200، مرة بيعطيكم 0، مرة بيعطيكم. It cannot be valid because it's unreliable. So that takes us to this quiz right here, and in this quiz, I am asking, like, look at those shooter and try to tell me if the shooters are reliable, valid, or neither. I know you can see the answers. The answers are supposed to be hiding, but that's okay. So the first shooter, all his shots are aggregated in an area. So he has a steady hand, kind of steady hand. Okay, however, he's not hitting the center of the target, and therefore that shooter is reliable, but he's not valid. The second shooter, his shots are clustered all over the place, even if he hit the center one time. Overall, he's just all over. So his hand is not steady, he's not reliable, and automatically he's not valid. The third one, maybe we should change this because that is not an accurate representation of what is happening. So his hand is kind of steady, less steady than the first one, but still, so a medium reliability, but there's no validity. So reliable, but not valid. Okay. And that takes us to the last shooter. That last shooter has a steady hand and he's hitting the center, and therefore we can talk about this one being a reliable and valid shooter. Okay, and so this way, that concludes our lecture today. This is a map of the things that we were supposed to be discussing. So عندنا study design and sampling plans. In the study design حكينا على ال designs in previous lectures. في عنا lectures that addresses bias and confounding يعني threats for internal validity. Okay, whereas here we talk about the sampling, the sample size, and the data collection. We still have, or maybe according when you're watching this, one lecture in the series which talks about the testing hypothesis and the measures of association. Thank you very much for your time.